Hi, my name is Meredith Hill. My topic of interest for this project is menopause and its effect on hypertension. These topics are of particular interest to me as during my courses study here in this program, I have developed an interest in women's health and menopause in particular. So in getting started, menopause is defined as the cessation of menstruation as a normal part of the aging process or sometimes due to the surgical removal of the ovaries. Menopause is said to occur around the age of 50, which is in the United States. It does vary in different parts of the world. This is a result of the change in hormone levels. Women experience an increased risk for chronic conditions such as heart disease, osteoporosis, and fractures, in addition to daily symptoms of fatigue, irritability, hot flashes, and other discomforts. Chen and al. Comment on evidence that hormonal changes in estrogen and testosterone have a significant effect on blood pressure regulation in that these hormone levels vary unevenly during perimenopause, and perimenopause is the time before or during the menopause time. And the outcome of hypertension is a strong risk factor for developing cardiovascular disease and other conditions such as stroke, kidney failure, and other medical conditions, along with premature death. According to the CDC, in 2011 to 2014, 84.1% of adults admitted to the diagnosis of hypertension, with 76% of these people admitting to taking medication to lower their blood pressure. Giacalone and Zessman in 2017 report that hypertension was the cause of 65,000 deaths and reportedly indirectly responsible for 377 deaths. In a study by Chen and al. In 2014, these authors questioned the effect of hormones on blood pressure regulation in women during menopause. These authors believe menopause is a prelude to hypertension due to the protection of endogenous estrogen and the loss of estrogen during this time, resulting in obesity and high blood pressure. And another study by Donnie Young and al. In 2015 performed a study relating to heart failure in the postmenopausal women. These authors report that heart failure can have lasting effects on morbidity, disability, and include the greatly increased cost of healthcare. Donnie Young and al. In 2015 believe precursors to heart failure are hypertension, diabetes mellitus, and coronary artery disease. So in looking at these three studies, the first one is titled Variations in Aging, Gender, Menopause, and Obesity and Their Effects on Hypertension in Taiwan. This study is done by Chen and al. In 2014. This study was a cross-sectional study exploring the effect of hypertension on menopause, age, gender, and obesity. This community-based study selected participants aged 20 and older, and these participants were asked to complete a questionnaire regarding their anthropometric measurements. The exposure of menopause was measured by self-reported information, and the outcome of hypertension was measured by stratifying the measurements taken and questionnaires used using multiple linear regression and a multivariate logistic regression. These results showed the risk for hypertension was 1.56 to 2.57 times higher in women than in men. Interestingly, these authors found that in women aged 50 and older, women had a lower risk for hypertension than did men. The analysis showed the odds ratio of women less than 50 years of age is 2.3, and in women older than 50 years of age is 1.88 with a 95% confidence interval. The strengths of this study are the strong strength of association as shown by the odds ratio and the statistically significant results. Confounders for this study are listed in Table 2 in the Heineken's criteria. Weaknesses of the study include the self-reporting bias of personal measurements, and temporality was not established. And in the second study by Lee and al. In 2012, this study is labeled the Independent Association between Age at Natural Menopause and Hypercholesterolemia, Hypertension, and Diabetes mellitus. This was a Japan nurses' health study. This study is a prospective cohort study inquiring about the age at which menopause takes place and whether it correlates with hypertension and other factors, including diabetes, hypercholesterolemia, lifestyle, and hormone therapy. The study population consisted of female nurses who lived in Japan. The study number was 26,034. The exposure of menopause was measured through a questionnaire filled out by each participant regarding the age of menopause and the cause, and the outcome of hypertension was measured by a baseline survey of self-reported blood pressure, cholesterol, and fasting plasma glucose measurements for the previous 2 years. These results were completed using a univariate logistic regression analysis and multiple logistic regression analysis. These authors did not find statistical significance when evaluating the odds ratio of hypertension and diabetes in menopausal women. The odds ratio reported in this study is as follows: premenopausal women 1.0 and the postmenopausal woman 0.72 with a 95% confidence interval. The results did show postmenopausal women had an increased risk of hypercholesterolemia, and the early age at menopause group had a higher odds ratio for hypercholesterolemia. Now, the strength of this study included a strong association for hypercholesterolemia, which could in turn lead to hypertension, though not the exposure this author was evaluating. The weakness of this study were the study population selection, recall, meaning the self-reporting of the measurements, blood pressure, labs, and another bias could be the healthy worker syndrome, as all participants were educated as nurses. Another weakness was the weak strength of association, and temporality was not established. And in the third article, this study is titled Risk of Heart Failure Among Postmenopausal Women, a secondary analysis of the randomized trial of vitamin D plus calcium of the Women's Health Initiative. This study was done by Danyang and al. In 2014. This study is a double-blind, random-controlled trial examining the effect of vitamin D plus calcium and the effect of lowering rates of heart failure in postmenopausal women. The sample size was 36,202 women between the ages of 50 and 79 years of age. In this study, 18,176 were in the cases, and in the control group, there were 18,106. The exposure of menopause was defined by self-report. The exposure of hypertension, the outcome of hypertension, was measured by abstracted medical records for those study participants reporting hospitalization due to any cardiovascular disease outcome. Results of this study also are shown in the Heineken criteria, and the results were stratified using a Kaplan-Meier curve and a forest plot of hazard ratios. Now, in this study, the overall CAD cohort is 0.95 with a high-risk subgroup of 1.06 with a confidence interval of 95%. And in using baseline data to assess risk status, these authors found a 37% lower risk of heart failure. The hazard ratio is 0.63. Another finding was that the personal use of vitamin D or calcium did not change any of the outcomes. Now, the strengths of this study were the moderate strength of association along with the multiple confounding factors listed in the Heineken criteria. The weaknesses were the self-reported recall of cardiovascular conditions, and the results were unclear as to which received more benefit, those taking vitamin D alone, those taking calcium alone, or those taking the combination of vitamin D and calcium. Temporality was not established. And this slide is the Heineken criteria, which puts together all of the information, the strengths of association. So in determining causation between the exposure and the outcome of hypertension, the results were all synthesized using the Heineken criteria. All three of these studies found a higher incidence of hypertension or factors that could lead to hypertension in the menopausal or postmenopausal women. The consistency throughout these studies was the strength of association of menopause and hypertension or factors that could lead to hypertension. And premenopausal. So in conclusion, premenopausal women are likely to experience hypertension. Menopause is shown to directly correlate with hypercholesterolemia, which very well could lead to hypertension. The risk of heart failure may be lowered with the use of calcium and vitamin D used in combination at this point. Future research is needed to evaluate the genetic component between hypertension and menopause. Lee and al. In 2012 considers that the genetic variation of estrogen may influence the risk of cardiovascular factors. Future research would also be benefited in studying different ethnic groups on the topic of hypertension and menopausal as well. Another factor for consideration for the future would be lifestyle habits. Whether age, obesity, or nutritional habits could have any impact on menopause and whether the risk of hypertension is increased. And the last topic for future research is the age of menarche. Menarche is the age at which a woman begins menstruation and the increased risk for cardiovascular disease. Lay and al. In 2017 performed a study regarding this topic and found that those who had an early age of menarche had an increased risk for cardiovascular disease. Thank you for listening to this presentation.